and welcome to another episode of Concierge Doctors of Scottsdale podcast. I'm your host, Dr. Mike Gonzales, and co-host, Dr. Lynnea Felton.
Hi, everyone.
And today we're going to kind of just talk about, what's the topic for today?
We're going to talk about legs today.
Legs. What about them?
So we have restless leg syndrome and leg cramps.
Okay. So anyone out there, suffering with these issues, maybe you can watch some of this episode and get a little bit more information on the things that you can do at home or naturally. We do a little bit more of a functional medicine approach, and so maybe some of the stuff in here you haven't heard of yet, and maybe there's stuff in here that the conventional model uses as well. So we try to cover both aspects. So let's jump right in. If you want to take it from here.
Yeah. So restless leg syndrome I see quite often in my office, and I thought I'd just give you guys just a basic overview of kind of how it's treated conventionally and how, kind of how we see patients come in with the kind of treatments that they've been given. So restless leg syndrome, it's also kind of a little bit of an offset of something that can usually happen at night. So people will usually complain of something like a crawling sensation, a burning sensation, something that's not pain. So really any type of sensation, really. And in literature, conventional docs have really found that treating with, iron, if there's an iron deficiency, that will usually present with maybe some of these types of sensations. But iron deficiency also presents with things like fatigue, and they're really pale, and they might have heart palpitations, these kinds of things. And then they might see that they have low dopamine levels, but looking in the brain, there's no evidence of low dopamine in the part of the brain called substantia nigra, like in Parkinson's patients, for example. Parkinson's patients usually have low dopamine as well, leading to their symptoms. And scientists that have looked at the brains of patients who just have restless leg have been diagnosed with that. There's no evidence of a dopamine deficiency in that area of the brain. But, these patients, if they have a lower dopamine that you can find on testing, that can certainly lead to restless leg syndrome as well. And then other deficiencies in neurotransmitters like GABA, for example, which is our, chill out, feel good neurotransmitter, that can happen as well. Mm-hmm. They've done some research where some side effects from different medications like anti-nausea medications, even antihistamines, especially the sedating ones, can cause these kinds of effects as well. And so, there's really no agreed upon understood mechanism for why restless leg happens, but they've found that deficiencies, like I said, in those neurotransmitters and iron and, lifestyle stuff. So you're doing a lot of caffeine, side effects from medications, whatever it may be, that leads to these kinds of things. And so
So before we get into treatment, because I'm assuming that's where you're going to go next, I just want to kind of let's cover the criteria, maybe letting people know, what exactly is restless leg syndrome? Is there a certain time that it comes up more frequently? Is it like at night or is it morning? And so just maybe covering some of that.
So mostly Caucasian females are dealing with this type of situation. They've done some comparison studies in terms of evaluating the prevalence of it with males and females, and women are much more likely to have this. And European descent as well. They don't really know why. This is just kind of what's happening in these different studies. They've done some studies also with the difference between pregnant women or people who have been pregnant before, also known as multiparous women, and nulliparous and men, kind of comparing those three categories. And if you're just comparing the nulliparous, so never had a child before, to men, it's much more obvious to have restless leg in the women who have been pregnant before. And the reasoning behind that is most women will start to notice that they have more restless leg symptoms towards the end of their pregnancy, and it usually stops, after they've delivered. So it kind of ramps up in symptoms as they approach their third trimester for around 25% of women who have these symptoms, which is pretty interesting, kind of high, that I would think.
Yeah. I think it's interesting that men get this issue too,
Yeah.
because I felt like I've seen the majority of the people that I've seen, it's mostly women. So, I mean, the literature does say that men get this as well.
Yeah, it's just really rare. I've just seen, majority of the patients that I see, I honestly don't think I've seen one man with this condition. Yeah.
But it's in the literature.
Yeah.
So
Yeah. That it happens.
Several.
So.
Okay. So what were you? I kind of cut you off.
No, it's okay. So to diagnose this, like I was mentioning earlier, there is no pain. I mean, people can explain a multitude of different sensations that they're having, like a crawling, like a burning, like a tingle, maybe not even a numbness, but it's just something between the knee and the ankle sensation that they have to move. And these symptoms are always alleviated by moving, but it's pretty short-lived. And people are like, okay, I move, feel better for a little bit, and then it's right back again. And this can kind of keep people up at night. So it does happen at night more often than not in most people. So this is pretty common that I see with people that have especially difficulty falling asleep. They're just kind of running in place.
Yeah. And you said there was a correlation between stress and restless leg? Yeah,
big time. So, it's just kind of that stimulating type thing. Body just can't calm down. And it's almost a relation to stress causing an issue with quality sleep. And so they've seen some studies with some sleep deprivation that a lot of people who just haven't had enough sleep, because they're stressed out or whatever reason, that they definitely see more prevalence of restless leg diagnosis.
Okay. Yeah. So that's a little bit of background on, what are the symptoms and who is more likely or more prone to get this, this condition.
Right.
So if you want to go ahead and jump into like, what are some ways that a patient with this condition can manage it properly, or even, is it possible to alleviate symptoms altogether and never experience an episode again? Like, can you essentially cure or rid yourself of restless leg syndrome?
So I never like to use the C word cure, because there's never 100% in medicine, and everyone is so different that I do see patients that we do pretty gentle things and they greatly improve. I would say like their episodes have diminished. They're not experiencing them as often, or, it's kind of been like, oh, I've gone a couple weeks, a month without these kinds of symptoms. So I never like to say that we can do things that make things completely go away, because that's quite a big of a promise that I don't like to make in medicine as well. Anyway, so, when we see people on, we'll start with antihistamines, for example, because there is a direct correlation that people have found in studies, as this is kind of a side effect of like Sudafed, for example. So if people are on that or any other type of sedating antihistamine, we try to get people off of that and try to figure out what the reason behind using the antihistamine. So what's going on with the allergies? Can we do something else, something different? Something like bromelain, quercetin, which are pretty common things that we use in practice as a supplement to just kind of help decrease that histamine response, and looking in their diet and adding in vitamin C and their environment as well. So if we can kind of diminish those kinds of allergic response, food too. So yeah, looking at that kind of allergic response to prevent them from using that antihistamine, for example, is just one way that we can kind of transition that. So if that was just purely a side effect from the medication, they go off the medication and they feel better, then awesome. Then we can kind of eliminate those symptoms of restless leg. There are a couple studies too that show that SSRIs, or selective serotonin reuptake inhibitors, like Prozac or Zoloft, which a lot of patients are on, taking them off of that, gently, definitely not cold turkey, addressing what the cause of anxiety or depression or whatever reason that they are on these kinds of things, and transitioning them to a different kind of lifestyle or treatment plan. If that's the side effect from that medication, take them off that medication safely under the supervision of a physician, and addressing kind of what in their life is causing those symptoms. Sure, that would alleviate the symptoms of restless leg as well. And then anti-nausea medications, like I mentioned before, like Zofran, for example, figuring out, again, what the cause of their nausea is. If we can address that through diet, lifestyle, or any sort of nutrient deficiencies, whatever it may be, chemotherapy, for example, like if we can just do something different that if that medication is causing that as a side effect, take them off. Awesome. Yeah. So that's kind of where some docs will start, like just looking at medications. Is it a simple fix? Can we transition you to something different that will do the same kind of thing, but more effectively and with less side effects? That's something that, literature has found to be pretty effective. And interestingly, I was finding that some conventional docs are starting to recommend yoga and acupuncture too. But more primarily in the forefront with them, they're just like, hey, let's reduce some stress. Let's figure out what's going on there. Let's get you exercising, get those muscles moving, just to kind of like burn out your energy bunny kind of thing. And they've done this with quite a few patients and have found that to be pretty effective and increase your sleep, improve sleep habits, also decrease caffeine, and maybe even doing some mental activity stuff. So like crossword puzzles or Sudoku or puzzle or other kind of, puzzle type activities can be helpful with just kind of busying the brain.
Yeah.
As naturopaths, we totally back up that all of those things, in addition to, like I was mentioning, yoga and acupuncture. I've done that with a few patients and they've noticed some pretty decent relief. There's some studies with magnesium supplementation in restless legs. So kind of, if there's a magnesium deficiency, it can lead to that sensation of restless leg or leg cramping, like I'll go into in a little bit here. So either doing oral supplementation of magnesium, either form of glycinate or citrate is really beneficial. Also, Epsom salt baths are really helpful too. Epsom salt is made up of magnesium. So it's just nice to kind of throw people in the tub, at night when these symptoms are happening, just with some, warm water, get them to kind of relax a little bit, get that magnesium absorption into their skin, and then they can have an easier sleep before then. So I've started with a number of my patients saying, hey, let's look at sleep habits. Let's see what you're doing before bed. Let's get you doing a little bit of yoga and Epsom salt bath and kind of try to go from there. So I've seen pretty good effect from starting pretty gentle like that, where it's really inexpensive. We're not putting them on any sort of, strict supplementation or even pharmaceutical intervention at that point. It's just, let's see what we can do that's pretty basic. That you can kind of start doing on your own and experiment with things and see how often you need to do this to see a benefit, and then just kind of going from there.
Yeah. Mm-hmm. Yeah. So it sounds like, the key to treating this issue is figuring out what's the causative agent. And you mentioned a lot of them seem to be medications, right? But you did mention that food might be a trigger as well. So maybe looking at, getting a food allergy panel done, figuring out what foods that you're responding to, and then removing those foods.
Yeah. So with food allergy panels, it's pretty interesting. When we kind of look at, the standard agreed upon food allergy, it's more like you eat peanuts, your throat closes up. You have shellfish, your eyes get really swollen and itchy, anaphylactic type stuff, or things that are kind of, pretty life threatening. But when we talk about food allergy panels in our sense of the term, it should more be a food sensitivity panel. So the difference between testing for food allergies and food sensitivities, I'm going to go on a little tangent here. Food allergies is more of an IgE immunoglobulin response, which is that immediate effect where things just kind of close up and get pretty scary and red. IgG can be more of a delayed response, and so that's a different type of immunoglobulin that can show symptoms within a couple hours to a couple days. And so people who have food sensitivities, the symptoms might not be as obvious. And so people, they typically say, well, for example, when I have dairy, I kind of get some diarrhea going on. And I know that to be true for me kind of thing. So then that's an easy fix because they've already related that. But we get people who come in and they're like, I don't know what's going on. I've been pretty fatigued, or I have migraines, or I have this pretty constant abdominal pain, or I have these rashes, or, can be restless leg stuff. Like whatever these weird symptoms are that people are experiencing kind of on a daily basis, it's not related to their menstrual cycle or whatever kind of, easier correlation. We look at food. And so there's a number of companies that we use for our food allergy testing or food sensitivity testing, that they can also test the IgE or that immediate response too. So, to see the relation between what's super dangerous that you absolutely need to avoid because it can throw you into an anaphylactic state versus kind of what's causing you issues that as a buildup over time is related to these migraines or rashes or whatever it may be.
And it's such an important tool to utilize the food allergy panels, because a lot of times there are patients, both women and men, that come in and they're not on any medications. Their lifestyle is relatively healthy, but yet they're still experiencing these symptoms and they can't really, pinpoint what is triggering it. And so a lot of times, coming back to the food aspect and getting a really deep picture of, maybe it's something in your diet that you're not necessarily thinking is causing you the issue, but it is. And a lot of times, things like healthy foods, for example, like almonds, even I've seen kale come up on a panel, and it's like you think that you may be eating foods that are great for you, but in reality, it's your body's responding to these foods. And it's not necessarily that you can't have it ever again. It's addressing the issue that lies in your intestines and in your gut, and then moving forward, repairing that issue, and then eventually you'll be able to eat those foods. But I think it's such an important tool to utilize because, like I said, it can give us answers to these issues that we just don't know where they're coming from.
Yeah, and when we look at these food allergy, food sensitivity panels, there should not be anything that comes up on these. I mean, in a, normal patient, quote unquote, heavy quotes there, you should not be reacting to food. As a human, we should be able to eat the food that we need for sustenance and nutrition and these kinds of things. And so when we run these panels and we see a number of different results, that's a sign of some serious inflammation that's going on. The body should not be reacting to food like this. And so that kind of, gives us some guidance as to, what you're reacting to, what we need to avoid for a set period of time, and then can start to reintroduce, but also showing us like, hey, there's a lot of inflammation going on in here. We need to address that as well. First, of course, by avoiding that food, but secondly, by addressing that overall inflammation. What else is going on in your life, and that we can kind of address and decrease that's happening in your body.
Yeah. Sorry, 1 second. The dog wanted to come into the office.
He needs attention.
So the other thing I wanted to mention with the food allergy panel, so I'm sure there's a lot of people out there wondering, well, why is my body even reacting to these foods? And so this is we're going to stay off topic a little bit, because I know the topic today was restless leg syndrome, but I think it's important to go into the food realm. And because a lot of people probably want to know, well, why, you say we're not supposed to be reacting to these foods, but yet it's coming up on my panel and I am reacting. So what is the issue there? And so when you dive into that issue, what's happening is a lot of those foods are some way or another getting into the bloodstream, and so your body's marking them as an intruder, and so you're building antibodies towards these foods, and those antibodies are acting like a really aggressive immune response that in turn turns into inflammation, and then that's when you get all the issues. And so I think when you do come back with a panel, and a lot of times these panels test for 196 different types of foods, and they're foods that were picked out that we eat on a regular basis. And a lot of times when they come back, depending on how many foods came up, that gives us an idea of, how much or how big of an issue the gut is, right? And so one way to address that is, I'm sure a lot of you may have heard of the term leaky gut, the medical term being intestinal permeability. And a lot of people have this issue where the lining of the intestinal tract is just, it's weak and it's open, and it's allowing these foods to slip through and reach the bloodstream. And so your body's having a response to that. And so the question is, well, what's causing this intestinal permeability? I get that question often. And it's, there's a lot of things that could be causing it. And again, it comes back to the medications that we're on. A lot of these medications that are supposed to be treating us and helping us with our issues, sometimes they have side effects. And those side effects might be a little damage to the intestinal gut, or maybe reduced acid production in the stomach, which in turn, that reduction of acid, can damage the lining of the gut. Other things, like if you're eating foods that are genetically modified with different pesticides, things like that, chemicals will damage that lining. A lack of the proper gut flora is another thing. If you don't have the right microbes in there, and you have you're leaning more towards the bad microbes, then they produce endotoxins and they can cause harm to that lining. And so I think addressing the gut that way, removing the food obviously first, because you don't want to keep that inflammation on all the time. You want to remove the food, address the issue in the gut, and then once you're ready, once the doctor that you've worked with, whether it's Lynnea Felton or another physician that's familiar with this type of medicine, once they get to the bottom of it, they give you the supplements that you need to address this issue. Then you can incorporate the foods that you had to get rid of, and then go from there. And a lot of times that it takes time. A lot of the it doesn't heal overnight. It's usually about a month or two long process. What would you say?
Typically with people, I'll do like a 4 to 6 week type thing. Mm-hmm. And what that means is avoiding every single thing that pops up on the food allergy panel as any sort of kind of blip. And so it doesn't matter if it's a pretty low reaction versus a super high reaction, because kind of with these super high reactions and low reactions, we notice that it doesn't really matter how they quantify that amount of reaction. You're still having symptoms. And so with our food allergy panel that we use quite often, that's in terms of 1, 2, or 3 stars, 3 stars being the most, 1 being the least. But with that 1 star, sometimes we can notice that's the most profound reactions that people are having on a daily basis. And those 3 stars may not be as bad, or the total reverse. So people are having super, significant reactions with the 3 stars, but with the 1 stars, not so much. So it really just depends on what's going on. But we don't, totally say, okay, well, since it's a 1 star, you're fine to continue eating that, because that might be the culprit that's causing a lot of the symptoms there.
Yeah. Yeah. A lot of these food tests, they're great tools to utilize, but a lot of time it's, the accuracy with any test, it's not always 100%. Mm-hmm. So I think, if it's reacting on the panel, whether or not the grade is severe or low, like 1 or 3, mm-hmm. then I think it's just good to eliminate them, mm-hmm. and then heal the gut lining, and then reincorporate them when it's ready or when it's time.
Yeah. So we usually heal the gut with things like glutamine that almost acts as so in the gut, we have these things called tight junctions, and the tight junctions should be tight as their name suggests. But when there's overtime inflammation, kind of that food acting as almost like a consistent scratch to the intestines, those tight junctions start to get inflamed and start to open. And that's when the food passes from the intestines to the bloodstream, and when the antibodies in our bloodstream kind of react to the food that's in there, because you shouldn't have kale in your bloodstream, right? So we'll start with glutamine. We'll start obviously with eliminating the foods as well. And then we'll do some herbal things too, like marshmallow tea or even slippery elm gruel. We'll do that. That's been pretty beneficial, and to kind of help act as almost like a neosporin to the inside of the body, and a Band-Aid too. So kind of giving the body a break, mm-hmm. and healing that lining, reducing the inflammation, allowing the tight junctions to start to heal again. And glutamine has been seen in numerous papers where that's exactly what it does, is it just kind of helps bind those tight junctions there.
Yeah. Yeah. So I think that was a great, off topic, mm-hmm. way to go, because a lot of people, want to hear this and want to know, why I'm not on medication, but yet I'm still having symptoms like restless leg syndrome. Right. And the thing with these reactions to foods is that, like I said, they can manifest as anything, mm-hmm. any symptom that you have. Say it's a rash, or I know you mentioned migraines. Migraines, mm-hmm. is another one. You can't, you say your hormones are in check, so it's not, a high estrogen state, and that's making you have a migraine, and you're still getting them, and yet you don't know what exactly is triggering that migraine or that headache. And it's, food is always one thing to investigate, and I think not leaving it off the table is your best bet. Mm-hmm. So was there anything else on restless leg syndrome as far as treatment? Yeah,
so there's this really cool thing that I've actually recommended to a couple patients now, and they're saying that it works, which I'm not really finding anything in literature explaining why. And you'll see how weird this is in a second here. So this came up actually interestingly enough on the show The Doctors and also on Dr. Oz, which, you know, I have my own feelings about that show sometimes, but sometimes they do have these really interesting kind of old wives' tales or things that we see work in practice. And one of these things is putting a soap bar under your sheets when you sleep with restless leg syndrome. And they've found that it doesn't really matter what brand. Some people say don't use Dove or Dial because it doesn't work, but I've had patients use it and say it works just fine. It needs to be an unscented version of things, but they've seen that lavender soap can be helpful too, because lavender is kind of an anxiety reducer. And so putting lavender in there will have a dual purpose. So you have the soap in there as well as that lavender scent to help address the sleep, anxiety component of things. But basically what you do is you put this bar of soap. You don't need to wet it or do anything other than just taking it from the wrapper, putting underneath your fitted sheet and going to sleep. That's it. Something super inexpensive. We don't know why it works, but it's pretty much an instantaneous reaction that people are noticing. So some people hypothesize that it's like distracting yourself at night, kind of like, oh, there's a bar of soap in the bed. That's kind of weird. I'll make sure to avoid that. Or even just like I'm kicking something around in my bed and it's just kind of taking my mind off of restless leg, or whatever is happening with this bar of soap, whether it's actually doing something to the reasoning behind the restless leg is happening. We're not sure, but I've seen it work.
Interesting.
Yeah.
That's a strange one.
It's very weird.
It's one of those out there treatments that, if it's no harm to the patient, then by all means, I mean, give it a try. If it's going to get rid of some of the symptoms, then why not, right?
Like when you think about it, there's really no potential for side effects here other than I was distracted when I was sleeping. And so that kind of helped, worsen sleep a little bit if that was to be true. But most of my patients are like, hey, that was really weird and that worked. And it kind of feels like this really naturopathic thing that we're recommending that's just like totally out there, something super inexpensive, kind of using what we like to call kitchen medicine, where it's like what you have in your house that has some health benefit, whether that be, just either distracting yourself from the symptoms or totally alleviating them as well. So it's kind of
so the science is unclear there, but I mean, it works, or it seems to work for some. So interesting. Yeah.
So sometimes I start patients on that just to be like, hey, let's just try this out, depending on kind of our relationship. So if they understand how weird we are and how weird I am, then we might go there first. Or we might do it like you've tried a whole bunch of other stuff. And I get patients like that often where they're like, yeah, I've tried all the things and nothing is really working. Then we might try something like this that's super weird, and that might be their answer. But it really just depends on kind of the individual and their needs.
Yeah. Yeah, I would feel like it's a distraction somehow.
Right.
And it just stops you from, triggering your legs or having that restless syndrome.
Yeah. It's almost like when, for example, if you had like a dog staying the night or something, like something else was in your bed and you knew that you couldn't roll over and smush it. Your brain is just like, okay, we need to stay in one spot. It's perfectly still so we don't disrupt whatever it is. It might be the same situation with the bar of soap. We're not sure, but I have seen it work. So it's pretty interesting.
Interesting. Was there anything else? I know we're kind of running a little long on time, so we could wrap this up.
Yeah. So just real quick with leg cramp stuff, I see this often as another nocturnal or something that happens at night. And some patients will be like, you know what? I wake up in the middle of the night, my calves are totally contracting and everything is really painful. And where we start with that, I mean, people might take some muscle relaxers or whatever it is conventionally, but as naturopaths, we like to offer something that's more addressing whatever deficiency or the cause again. And so with this, where I'll usually start with people is figure out kind of what their sleep routine is. Can we improve that? Can we reduce stress? Can we also introduce magnesium there? So magnesium glycinate is usually the one that I'll go to, but magnesium citrate has kind of the added benefit of helping to calm down the mind and also help improve bowel function. So increase those bowel movements per day if we have a constipated patient.
One funny way to remember this. So magnesium citrate is good for bowel movement. And so a lot of times in the clinic we'll call it magnesium citrate. So
which gets a laugh and gets people to remember of why they're taking it.
And that's one way you can remember it. And so you said the glycinate, what exactly is glycinate is more focused towards muscle.
Yeah, so that'll just help calm things down. And majority of people have magnesium deficiency that's leading to the muscle cramping. And so really it's like, well, I'll just give you magnesium citrate, because typically people, if they have kind of these other bowel issues with more of a constipation stuff, or they're having issues kind of relaxing their mind before they go to sleep, then we'll usually just reach for magnesium citrate because it's pretty readily available. Magnesium glycinate, you can purchase it at health food stores as well, or kind of through us, or whatever, wherever you're purchasing it from. But I've seen that work really well, and kind of, I don't like to use that C word, but when people are on magnesium and that's the cause of their leg cramping, we can see, kind of a cure of leg cramping as well.
Or at least some alleviation of symptom.
Right.
And I think that's another thing to mention. A lot of people just don't realize when it comes to supplements, certain forms of the supplement have different effects on the body. And so this is one example, and we won't go off into a tangent too much here, but there's several different forms of magnesium. So right now we mentioned 2, which is magnesium citrate, which is great for bowel movement, magnesium glycinate, which is great for muscle relaxation, and then there's other forms like magnesium oxalate. And so working with a practitioner that understands these these various forms and are able to utilize them in ways that help you improve your health or your condition is something that you should really think about and look into, because a lot of times it can be overwhelming walking into a grocery store like Sprouts or Whole Foods and going to the supplement aisle and seeing these supplements and just thinking, oh, it's magnesium, so it should have all these benefits, but a lot of times that's dependent on the form that you're taking. So working with someone
and the dose too,
and the dose. See, that's another thing. With supplements, for the most part, the dose that you see on the bottle isn't necessarily the therapeutic dose. So the dosages that we use tend to be a little higher. And it's because it's under our supervision. We're making sure that these patients are going to be safe, that they're not it's not interacting with any of the medications that they're on. And so, we're trained to really get the effective dose from these supplements, because a lot of times people will buy them, they'll take the dose that's implied on the supplement, and, they're not getting the benefits that supplement could have. And at the end of the day, especially if you're working on a budget, you could be potentially wasting your money on these supplements and not getting anything out of them. So, quick tangent, it's important to work with someone that knows how to utilize these supplements, knows how to utilize the different forms that are out there, and really helping you get the biggest bang for your buck. So yeah, anything else that you wanted to add for?
So appropriate hydration, making sure that your water has electrolytes and minerals repleted in that. Sometimes when we get the RO water that's present in Arizona, kind of where we're from, we get a lot of patients who are just like, I'm drinking this water and my legs are cramping now. So that's a pretty easy fix, where we just recommend that they replete their water with mineral drops too. And so leg cramping tends to be more of an easier approach for us, where we know that these things work, and they work with a majority of patients too. So it's pretty simple things that we can do with magnesium and hydration, kind of appropriate stretching too, making sure that, we can also implement yoga here too. But, regular stretching, especially after working out, or, if it's kind of a longer run day, making sure that you're doing some electrolytes and stretching after that as well. That should help alleviate some of those symptoms for you.
Great. I think we covered a lot of stuff today.
Yeah.
And there's so much more stuff that we could go over with. I know she mentioned RO water just now. I can rant on and on about that.
Yeah, that'll have to be a different day.
Yeah. And so, guys, I really hope that you're able to take something away from this. Even if you're not our patient, our goal here is just to spread awareness and educate patients to take back their own health and understand that a lot of times it might be a little bit more than a medication. It might be diving into a little bit more of a lifestyle or the supplement realm, trying new things. But the goal is to really just give you your health back. And so I really hope you got something from this. Again, thank you for joining us. And we're definitely going to do a lot more of these videos because, like I said, there's just 1,000 topics we can rant on about for hours.
We're good ranters.
Yeah. And so, again, thank you for watching. If you have any questions or comments, or you want us to go deeper into some of these topics, please, comment below on the YouTube channel. You can reach us on Instagram at Concierge Doctors, and just send us a message, and we'd be happy to answer those messages. A lot of times, our practice is built, it's a concierge concept, so a lot of times you're going to hear back from us, which is really nice, because our patients that we work with, their doctor is pretty much in their pocket. So as long as they have a phone, they can text us and call us at any time. There's no hassle with having to work with the front desk staff to try to get a hold of us for a quick question. So, the way we operate is we're trying to we're eliminating the obstacle between the patient and the doctor, and it's just straight interaction. So again, if you have questions, just reach out to us and we will get back to you. And subscribe to the channel if you like this stuff, or like our page. So thank you guys.
Yeah. Have a good week, everyone.
All right. We'll see you later.